Hi Bettina, so this is a follow-up to my written assessment for the Shang Lun. In my essay I compared chest spines with glomus, so Shang with Beijing patterns, and then I went into the 5 different kinds of Xie Tang formulas. So for the video assessment I've chosen to go a little bit more into chest spine and compare the 2 formulas Da Xian Tang and Shao Xian Tang, treating major and minor chest spine. And then I also got 2 case studies from a textbook that I will use to demonstrate the use of each. So Zhexiong, or chest spine, is a pattern that occurs when an exterior pathogenic influence falls into the chest and diaphragm, and this is said to be a result of incorrect purgation when treating Taiyang disease, but can also occur in the absence of mistreatment. So the exterior pathogenic influence produces pathogenic heat, which then binds with water or phlegm in the chest. And this brings about the symptoms of chest spine, which are epigastric pain with palpable hardness and fullness. So clause 128 of the Shang Lun reads that pain on pressure along with a floating Sun pulse and a submerged Guan pulse indicates chest spine. So the Sun pulse relates to the upper jiao, which is the disease location in the chest, and it's floating because the pathogen is young in nature. So this reflects the heat that's formed in the chest. The submerged Guan pulse relates to the middle jiao accumulation in the epigastrium and refers to just the water there. So this is a pattern that's young, excess, and characterized by pain aggravated by pressure. There can be a few subtle differences in symptoms indicating either excess cold and excess heat, and there can be varying severities, but like I said, I'm just going to compare 2 of the formulas used to treat the excess heat pattern, not the excess cold pattern. Da Xian Tang, or in English called the major sinking in the chest decoction, the pattern there is characterized by chest spine that presents as a severe pain in the region of the epigastrium that might also extend down into the abdomen as well. So they should feel a stone-like, you, the practitioner, should feel stone-like when pressed, the epigastrium, and the patient is unable to bear any pressure when you're trying to palpate it. There might also be bound stool, afternoon tidal fever, as well as a sunken tight pulse, so a little bit different to clause 128. You might also see shortness of breath and irritability. Apparently this pattern is rarely seen as it's quite severe and acute, and its composition is very strong and even slightly toxic. But if the signs are right, you can make up the formula, which is using 0.3 to 0.6 grams of gansui, 18 grams of da Huang, and 9 to 12 grams of meng shao. These herbs work together in the formula to drain heat, expel water, flush the excess, and break the bind. So gansui is a harsh expellant that's said to violently purge the bowels to strongly eliminate harmful body fluids and clear heat. It's also worth noting that gansui shouldn't be combined with gansao, so if you're ever combining this formula with another formula that does contain gansao, that those 2 herbs should not be used together. Da Huang, we know very well, clears heat and drains accumulation and stagnation by inducing a bowel movement, and it's a Tuiya with meng shao, which helps to soften hardness and moisten dryness to help that purge of the heat and accumulation. And for the second formula, Shao Xian Tang, or minor sinking in the chest decoction, this minor chest spine pattern presents as a chest spine that's just limited to the epigastric area, and the hardness and pain doesn't extend down to the abdomen like it does in the major chest spine, and it may be tender with or without pressure, but it won't be such a severe pain like it is in major chest spine. And the pulse is floating and slippery rather than sunken and tight. So this is a more mild and moderate condition and composition compared to the one in the Da Xianxiong Tang pattern. So it is more widely used in clinics, or at least I've seen it discussed more in texts and seen it used more in clinical practice in my experience so far. So if all the signs are right, make the formula with 15 to 30 grams of gualoshe, which is the whole fruit, 6 to 9 grams of huangliang, 12 to 15 grams of banxia, and those herbs will work together to disperse the phlegm, open the bind, as well as clear some heat. It opens with acridity and downbears with bitterness. So the bitter and cold huangliang drains the heat bind from the epigastrium, and the acrid and warm banxia flushes the phlegm. Sweet and cold gualoshe flushes, assists huangliang in clearing heat and banxia in transforming phlegm, and opens the bind by conducting the phlegm downwards. According to Huang, banxia and gualoshe together treat oppression and pain in the chest, and they don't just appear together in this formula, but also in a formula called gualoshe by banxia tang. So just a little recap, in terms of the abdominal presentation, the major chest bind Da Xianxiong Tang pattern, there's hardness and pain that's intolerant to palpation, not just in the epigastrium, but in the area extending down to the lower abdomen, so down the stomach duct, and then in the Shao Xianxiong Tang pattern, the fullness and distension is just isolated to the epigastric area alone, and is tender on pressure, but doesn't feel hard or stone-like per se. In terms of the pulse presentation, the Da Xianxiong Tang pattern is said to match a submerged, tight and forceful pulse, whereas the Shao Xianxiong Tang pattern is either slippery, rapid, or slippery, floating. And for a case to demonstrate the use of both of these formulas, I pulled these from Shang Explained, the text by Robin Marchment and Greta Young, just this one here that we've been using in class. So demonstrating the use of Da Xianxiong Tang, the case reads, a 15-year-old female was suffering from a headache and generalized discomfort. After 5 days, she'd had a sudden attack of acute abdominal pain with fever that was worse in the afternoon, along with general malaise. She was diagnosed with peritonitis, which is inflammation of the peritoneum that lines the inner wall of the abdomen. Her pulse was tight and forceful. Her tongue coat was yellow and thick but not dry, so they've included that in there to differentiate it from the Da Chengqi Tang pattern. She hadn't moved her bowels in 7 days, and there was rebound abdominal pain. Her urine was dark and scanty, she had no appetite, and her speech was delirious, so a bit of irritability there. A modified Da Xianxiong Tang was prescribed with the usual Da Huang Mang Shao Gan Sui, but then they also added in Dongguazi, winter melon seed, and Yi Ren. So the constipation, delirious speech, and tidal fever might make you think, oh, Da Chengqi Tang, but because her tongue wasn't dry, and the pain resisted pressure, there was that rebound pressure, it's actually a Da Xianxiong Tang pattern. So she took the formula, she had a bowel movement an hour later, and then after her second dose, she had a loose bowel movement, which marks the resolution of that pattern, and so that formula was no longer indicated after the loose bowel motion. And for the Shao Xianxiong Tang case, it was one of recurrent tonsillitis. There was a 28-year-old female patient that had been having tonsillitis on and off for 5 years, around 3-4 times a year, but her most recent bout had been lingering for over a month. It was triggered by excessive spicy food and white wine. She complained of a subjective sensation in the chest. There was a glomus, a parched throat with scorching pain, a cough with sticky phlegm, a dry bowel movement, and the throat was inflamed. Her tongue was red with a thin yellow coat, and the pulse was floating and slippery. Important there. The diagnosis was phlegm heat knotted in the throat and chest, so she was prescribed Shao Xianxiong Tang with the usual gualoshe, banxia, and huangliang, with the addition of bei sha shen, zhegang, xuanshen, and gansao to support the signs of cough and sore throat. So after 5 bags of the herbs, her condition improved, and she was given a further 5 bags to ensure complete recovery. Something interesting to note across these 2 cases is the treatment course. So as we mentioned, Da Xianzhong tongue is quite a harsh, it's an acute, quite serious condition and quite harsh composition, so just 2 doses were necessary for resolution, whereas with the Xiao Xianzhong tongue case, 5 bags were necessary to resolve the case. One consideration to make though is that the first case for major chest bind was pulled from an old text called the Shanghan Jie Yao, whereas the Xiao Xianzhong tongue minor chest bind case was a more modern case study from Greta Young's own collection. So just something interesting to note, because I guess in modern day clinics we see patients less frequently, so we might be more likely to give them more doses to last them until we see them next. I've also noticed in the literature and in my observations, feeling grateful for getting to know these 2 formulas a bit better now, and look forward to experimenting them and with the prescription of them in clinic and seeing what the results might become. Thank you for listening, and I hope I didn't bore you too much.